Hello friends, welcome again to the third session of the demonstration on ENT instruments. I am Dr. Professor Rahul Kawatra, Professor and Head, Department of ENT in the Institute of Medical Sciences, Safedabad. So before we begin the today's session, I have a request to make that I would like you to kindly subscribe the channel if possible, so that you keep getting updates about all the interesting videos and the practical tips that I am going to be sharing with you people in the coming video sessions for the practical exam in ENT, because it will not be possible for me to post these videos in individual groups. So if you would subscribe and share the videos, it will be better. So and if you like it, you can always give a like, and if you have any doubts or any comments, you please post it there. I'll be happy to answer them. So let's start. Today we are going to talk about the instruments used in septoplasty. So the very first thing that I'd like to tell about septoplasty is a surgery which is done for correcting the deviated part of the nasal septum. And there is a similar operation called as SMR, submucosal resection of the nasal septum, which is also done for correcting the deviated part of the nasal septum. So this surgery is also done to harvest the septal cartilage for doing surgeries like rhinoplasty, where we are wanting to correct the external part of the deviated septum of the nose, and you need cartilage to correct the deformity externally also. So it's part of the surgery called rhinoplasty, or it can be used to approach the sphenoid sinus, which is at the back of the nose, for doing transnasal pituitary surgeries. So we have to remove the part of the nasal septum to approach to the sphenoid sinus, which needs to be opened up, and then you go to the skull base anteriorly. So the very first step that we do in septoplasty is after doing a nasal packing to decongest the nose. This instrument is used for that, which is called as Tilly's nasal packing faucet. It's a multi-utility instrument used for doing anterior nasal packing. It can also be used for removing animate foreign bodies or inanimate foreign bodies like bits of paper or rubber tubings which children invariably put inside the nose. And it can also be used in the oral cavity to apply any medication with the help of the gauze piece, or it can be used for removing foreign bodies lodged in the crypts of the tonsil. It can also be used for ear packing if the other packing forceps are not available. So it's a multi-utility instrument. So after doing the nasal packing, you remove the pack, the nose is decongested. The very first thing is the incision given with the BP handle, and a 15 number blade is used for giving the incision on the caudal part of the nasal septum. Okay, this incision is called as the Freer's incision. There are two incisions. One is Freer's incision, which is commonly used for septoplasty, and there is another incision called as the Killian's incision, which is given about 3 to 5 millimeters ahead of the caudal margin of the nasal septum, called as Killian's incision. It is used in SMR. So the advantage of giving Freer's incision is that it is given in an avascular plane in the membranous septum, and it is easier to go on both sides of the quadrangular cartilage from single incision. So you can convert into a complete transfixation incision, and you can go on both sides, and then this incision can be combined with rhinoplasty if we have to correct the external deformities. So after giving the incision, the ela is retracted using this instrument called as the Killian's Nasal Ela Retractor. So it's a double pronged instrument. You elevate it, it elevates the nasal ela and gives a wider visualization of the nasal vestibule and the area where you are planning to start your surgery. Another instrument that can be used is this Sodicums nasal speculum. This instrument is commonly used for evaluating the nasal cavity in the OPD, but it can be used in surgery for the initial part of the surgery. It is an important instrument because it's very commonly asked how this instrument is held in the practical exam. So I always tell my students is to hold it with the thumb and the index finger, and you place it in the front pointing towards the patient and rest it on the remaining 3 fingers. Then you gradually take out your middle finger and keeping this closed, you introduce it into the nasal cavity and retract. So this part elevates the ela and this is on the lower part of the septum. So you get a proper view of the anterior part of the nasal cavity. So this is how it is used. So you stabilize it with your thumb and index finger. You keep the fulcrum on the 3rd finger and the last little finger, and with the middle finger you press on this lever. So this is how it is used. Another simple way is by just making a fist and putting it here, taking out your first finger and then holding it with the thumb, pointing it. Care is to be taken that it has to be pointing towards the patient, not on the other side. Remember that. Okay? And then you take out this middle finger and you use it like this. Alright? So once you have visualized the area of the incision with this, you gently start to elevate the mucoperichondrial flap, and usually we do it initially with this suction elevator, which is a very useful instrument because we attach a suction at the back and you can simultaneously suck the blood that is coming and you get a good visualization of the septum. In this manner you gradually elevate. Care is to be taken that the convex part of this elevator is pointing towards the perichondrial flap side, and this concave part is pressing onto the nasal septal cartilage, which you are trying to slowly elevate. You are not supposed to do poking movements which can tear the flap, so it has to be gentle and you gradually elevate it. Once you have adequately elevated the flap, you can use another suction to clear more secretions. This is a nasal suction tube which is used for clearing the secretions in the nasal cavity. Alright, and it can be used in other nasal surgeries also, where for functional endoscopic sinus surgery or other surgeries in the nose. So this suction is a very useful instrument that your assistant holds, trying to give you a good view of the part that you are operating. Okay, and once that is done, you use this instrument which is called as the Killian's long bladed self-retaining nasal speculum. The correct way of holding this instrument is in this manner. You always remember to hold this instrument with the prongs pointing forwards and downwards. You never hold it like this. This gives a wrong impression that the student doesn't know how to use this instrument. So it should be held in your left hand. You gently press it and you tell the examiner that this retracts the flaps. This part goes towards the septum and this part will retract the elevated flap, and you've got the septum in between to visualize. And if you are doing an SMR operation, then you've got the septum right in the center and you can visualize both the flap, separate both the flaps. So this is how you use this instrument, and the self-retainer screw can be put in if you don't want to keep this thing pressed for a long period of time and you're wanting to work straight away there, and you want this hand to be not if you are getting tired and the surgery is long, so you don't need to keep pressing it. So you can just put this elevator and keep working at the adequate distance. So this is your Killian's long bladed nasal speculum. There are other sizes for depending upon the whether you want to do it in a small which age group. Based on that, the length of the nasal cavity, you use the required size of the speculum. So once the flaps are separated out, you have got a good vision, then you can further separate the cartilage from the perichondrium flap with this sharp instrument called as the Freer's double-ended elevator. This is used for making the upper tunnel, and this is used for joining the mucoperichondrium with the mucoperiosteal tunnel that you will be making later on. So this is how, again, the convex part lies outside and this part is pointed towards the septum, and you are gently elevating it. So this is another important elevator called as the Freer's double-ended elevator. And you've got another elevator which is a blunt dissection elevator called as the Howard's elevator. This also is used for elevating the mucoperichondrial as well as the mucoperiosteal flap, which is over the vomerine bone and the maxillary crest area. And this sharp end of this Howard's elevator is used for disarticulating or separating the cartilage from the maxillary crest. So this is the crest, this is the cartilage. You separate it with this and you shift the cartilage on the opposite side, and you have access towards the mucoperiosteal flap of the opposite side also. So you elevate that part of the mucoperiosteum from the vomerine bone and the ethmoid perpendicular plate of the ethmoid bone on both the sides. So you've got two flaps at the back, which are the mucoperiosteal flap, and one flap which is the mucoperiosteal flap. So this is how you differentiate between SMR operation and septoplasty operation. In SMR you elevate both sides mucoperichondrial flap, but in septoplasty we save the blood supply from one side of the mucoperichondrial flap. It's not elevated, it's elevated only on one side. So after this we make another incision in the anteriorly just above the nasal spine, in front of the nasal spine, to elevate the mucoperiosteal flaps, and you use this Joseph's nasal elevator and you go all the way back. This is a sharp dissecting one, so since the mucoperiosteal flap is more rough and more rigid and requires more force, so you gradually elevate it all the way back and you join the two flaps of the mucoperichondrium and the mucoperiosteum on the same side, and you move on the other side and you elevate the mucoperiosteum of the opposite side. Alright, so this is the Joseph septal elevator. You can recognize it by this long shaft that it has, and it is sharp. And once you have elevated, you have the cartilage in the center, you have the vomerine and the ethmoid bone at the back. So if you have to remove, or you can score, if there is gentle deviation, you can just simply use your blade to score the cartilage and remove the memory and the bands, and these cartilage will straighten out. And you can make small incisions, box-like or small slits, which can then be separated from the other side and taken out with the help of this faucet called as the Blakeslee faucet. You can take out those, or there is another faucet called as the Lux faucet, which will disarticulate that separated cartilage and taken out. So this instrument is also a multi-utility instrument called as the Lux forceps or the Lux forceps. You have to differentiate it from the Dennis Brown tonsil holding forceps, which I had shown you in my first demonstration. This is narrow and it has got a slot in between. So this is used for punching out deviated part of the septum, and chips of bones and cartilages can be taken out during nasal surgery. It can also be used for removing the polyp while doing nasal polyp surgery or endoscopic sinus surgery, for removing other residual tissue or tags from the nasal cavity. This instrument can also be used in the oral cavity to take out biopsy punches from the cheek or the oral cavity, and it can also be used for holding fibrotic tonsils, which cannot be held by those Dennis Brown tonsil holding faucet, and their tonsils are fibrotic quite inside, and you have to remove them. So you can hold this because it's got a better grip and it's a little more sharper instrument. Okay, and so this is also a multi-utility instrument, and it can also be used elsewhere wherever you want to take a biopsy punch, okay, from elsewhere. So then if you have to remove more part of the cartilage, then you can use this Foreman's angulated scissors to cut the cartilage, and then you can take it out using the Tilly's faucet, which is this, or you can use the Lux faucet, or you can use this Blackesley straight holding faucet. Another instrument that can be used for cutting the cartilage is this turbinectomy scissors, which is again a sharp and a long slender scissor, which is used for doing partial resection of the inferior turbinate, and also for removing or giving sharp incision over the deviated part of the septal cartilage. So once you have removed the deviated part of the septal cartilage, then we go on to focus on the deviated part of the nasal bone, the vomerine crest or the vomerine bone or the maxillary crest. If there is a deviation there at the maxillary crest area, you use this instrument, which is called as the Killian's this is the Tilly's nasal gouge. So why we get confused is that there is an instrument called as Killian's nasal gouge, which is also very similar to this instrument. Only difference is the shape of the cutting edge, which is V-shaped in Tilly's nasal gouge and it is U-shaped in Killian's nasal gouge. So you must take care to see the cutting edge. If it is V-shaped, you call it Tilly's, and if it is U-shaped, you call it Killian's. There's no other difference in that. And V is basically there to give a good hold on to the deviated part of the maxillary crest. So you hold it and you keep it parallel to the nasal floor, and with this Heath's, called as Heath's mallet, you gentle taps strong enough your assistant gives to break or fracture the bony spur which is there over the maxillary crest, and then that can be out fractured and taken out with the help of the Lux faucet. So this is about the removal, and once you have straightened your septal cartilage and removed the spur of the nasal bone, you repose the flaps, take care, do suction, clean out all the debris, all the clotted blood, so that there's no hematoma formation. Look for any bleeder, try to cauterize it, or you have to maintain hemostasis so there is no collection of blood, no active bleeder in the bone area or in the cartilage area, so that there is no hematoma formation. And once you have done that, you repose back the flaps and we suture it back using a needle holder and the Adson's faucet, and we give sutures at the point of incision where we made the Killian's incision or the Freer's incision. We use absorbable sutures, which is 3-0 Vicryl or 3-0 chromic catgut. We give transfixation, interrupted suturing rather on both sides. You put the needle and you pass it across the cartilage, bring it back, and you tie it. And care has to be taken that there is no exposed cartilage to avoid any kind of infection there. So I think we have finished with this. So I hope that you like the video, and you can definitely subscribe. I'll again say that, so that you can see more of these videos and other practical tips related to your practical exams. Thank you.